Understanding women's urinary tract infections and how to protect yourself. Urinary tract infections are one of the most common health issues women face, with nearly 50 to 60% of women experiencing a urinary tract infections at some point in their lives. While these infections can be uncomfortable and inconvenient, the good news is that urinary tract infections are preventable and treatable with proper care and attention. This article will explore what causes urinary tract infections, the symptoms to watch for, and effective prevention strategies to help protect yourself from urinary tract infections. What is a urinary tract infection? A urinary tract infection occurs when harmful bacteria enter the urinary system, which includes the kidneys, bladder, ureters, and urethra. Although urinary tract infections can affect any part of the urinary tract, they are most common in the bladder, known as cystitis. Urinary tract infections are caused by bacteria from the skin or rectal area that enter the urethra and travel into the urinary system. Why are women more prone to urinary tract infections? Women are more susceptible to urinary tract infections than men due to several anatomical and physiological factors. 1. Shorter urethra. Women have a shorter urethra than men, which means bacteria have a shorter distance to travel to reach the bladder, making it easier for infections to occur. 2. Urethral proximity to the rectum. The female urethra is located close to the rectum, which increases the risk of bacteria from the gastrointestinal tract entering the urinary tract. 3. Hormonal changes. Hormonal fluctuations during menstruation, pregnancy, and menopause can alter the urinary tract's natural defense mechanisms, increasing vulnerability to infection. 4. Sexual activity. Sexual intercourse can push bacteria into the urethra, making urinary tract infections more common in sexually active women. Symptoms of a urinary tract infection. The symptoms of a urinary tract infections can vary depending on the severity and the part of the urinary tract affected, but common signs include frequent urge to urinate, feeling the need to urinate often, even if you don't pass much urine, pain or burning sensation, a burning feeling while urinating, dysuria, cloudy or strong-smelling urine, urine that appears cloudy, dark, or has a strong, foul odor, pelvic pain, discomfort or pain in the lower abdomen or pelvis, blood in urine. Urine may appear pink or red due to the presence of blood. Fatigue and fever. In some cases, a urinary tract infections can cause general fatigue, fever, or chills, especially if the infection spreads to the kidneys. If you experience any of these symptoms, it's important to seek medical attention promptly. Urinary tract infections can usually be treated with antibiotics, but if left untreated, they can lead to more serious complications such as kidney infections. Underscore 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 underscore. How to protect yourself from urinary tract infections. While it's not always possible to prevent a urinary tract infections, there are several strategies that can significantly reduce your risk. Here are some practical tips for women to protect themselves from urinary tract infections. 1. Stay hydrated. Drinking plenty of water is one of the best ways to flush bacteria out of your urinary tract. Aim for at least 8 glasses of water a day. Proper hydration ensures frequent urination, which helps wash bacteria from the urinary system before they can cause an infection. 2. Urinate when needed. Don't hold in urine for long periods. Urinating frequently helps flush out any bacteria that may have entered the urinary tract. After sexual activity, make sure to urinate as soon as possible to remove any bacteria that may have been introduced during intercourse. 3. Wipe from front to back. When using the toilet, always wipe from front to back to prevent bacteria from the rectal area from entering the urethra. This simple habit is particularly important for women and can greatly reduce the risk of urinary tract infections causing bacteria spreading. 4. Practice good hygiene. Maintain good genital hygiene by washing the genital area with mild soap and water. Avoid using harsh soaps, douches, or feminine hygiene sprays that can irritate the urinary tract and disrupt the balance of good bacteria. 5. Avoid irritants. Some feminine products, such as scented soaps, bubble baths, and sprays, can irritate the urethra and bladder, increasing the risk of infection. Stick to unscented products and avoid using products that may disrupt the delicate balance of bacteria in the vaginal area. 6. Wear cotton underwear. Cotton is a breathable fabric that allows moisture to escape, keeping the genital area dry. Avoid tight-fitting underwear or clothing made from synthetic materials that can trap moisture and create a breeding ground for bacteria. Opt for loose-fitting, cotton underwear whenever possible. 7. Urinate after sex. Sexual activity can introduce bacteria into the urethra, so it's important to urinate soon after intercourse. This helps flush out any bacteria before it has the chance to cause an infection. 8. Use probiotics. Probiotics, particularly those containing lactobacillus strains, can help maintain a healthy balance of bacteria in the vagina and urinary tract. Some studies suggest that probiotics may reduce the frequency of urinary tract infections, especially in women with recurrent infections. 9. Cranberry juice or supplements. Cranberry juice is often touted as a remedy for urinary tract infections, and while the research is mixed, it may help prevent the adhesion of bacteria to the walls of the urinary tract. If you opt for cranberry juice, choose a variety that is low in sugar or take cranberry supplements with a high concentration of active compounds. However, cranberry is not a treatment for an existing urinary tract infections and should only be considered as part of a prevention strategy. 10. Avoid using spermicides. Spermicides, often used in certain forms of contraception, can increase the risk of urinary tract infections by altering the balance of normal vaginal bacteria. If you experience recurrent urinary tract infections, consider discussing alternative birth control methods with your healthcare provider. When to see a doctor. If you suspect you have a urinary tract infections, it's important to seek medical attention as soon as possible. A healthcare professional will typically diagnose a urinary tract infections through a urine test and may prescribe antibiotics to clear the infection. If you experience recurring urinary tract infections, your doctor may recommend additional tests or preventative treatments, such as low-dose antibiotics. In severe cases, if the infection spreads to the kidneys, you may experience more serious symptoms, such as high fever, nausea, vomiting, or pain in your back or sides. In such cases, seek immediate medical care. While urinary tract infections are common among women, understanding the causes and practicing effective prevention strategies can significantly reduce the risk of infection. Staying hydrated, practicing good hygiene, urinating frequently, and taking steps to protect your urinary health can help keep your urinary tract healthy and free from infection. If you do experience symptoms of a urinary tract infections, prompt treatment with antibiotics can help you recover quickly and prevent complications.